Now medical assistant questions and answers. Question 1. A patient's urine tests positive for glucose. The doctor asks you to confirm this finding. Which of the following would best confirm this finding? Option A. Run the urine on the handheld glucometer. Option B. Have another Ma do a repeat dipstick. Option C. Run a clinitist. Option D. Run an ACE test. The correct answer is option C. Run a clinitist. Clinitist is used to confirm reducing substances such as glucose in urine. A handheld blood glucometer is not the appropriate confirmatory urine test. Question 2. The smallest of the white blood cells which also can be involved in humoral immunity is the option A. Lymphocyte, option B. Basophil, option C. Erythrocyte, option D. Monocyte. The correct answer is option A. Lymphocyte. Lymphocytes are among the smallest white blood cells and play an important role in humoral immunity through B-cell antibody response. Erythrocytes are red blood cells, not white blood cells. Question 3. Your doctor has given you a patient memo that he has written. You notice that his grammar and punctuation need to be corrected. Which of the following proofreader's mark signifies that a period is to be introduced into a sentence? Option A. Equal sign. Option B. Circle with a dot in the middle. Option C. Ellipsis. Option D. Empty circle. The correct answer is option B. Circle with a dot in the middle. The proofreading mark for inserting a period is commonly represented by a circle with a dot. This tells the typist to add terminal punctuation at that location. Question 4. As a rule of social acceptance, what is the maximum number of times a telephone should be allowed to ring in most cases? Option A. 3, option B. 5, option C. 7, option D. 1. The correct answer is option A. 3. A professional medical office should generally answer within 3 rings when possible. Prompt answering supports patient service and reduces missed calls. Question 5. When answering the telephone, other than taking a patient's name, what other piece of information should be gathered at the beginning of the call? Option A. Telephone number. Option B. Date of birth. Option C. Reason for the call. Option D. Address. The correct answer is option A. Telephone number. A callback telephone number should be obtained early so the office can reconnect if the call is dropped. It is also essential for follow-up communication. Question 6. Which of the following telephone greetings would be best? Option A. Hello, Dr. Smith's office, please hold. Option B. Dr. Smith's office, how may I assist you? Option C. Dr. Smith's office, this is Mary, how may I assist you? Option D. Dr. Smith's office, this is Mary. The correct answer is option C. Dr. Smith's office, this is Mary, how may I assist you? The best greeting identifies the office, identifies the staff member, and offers assistance. This is professional, clear, and patient-centered. Question 7. Which of the following responses would be best when addressing an irate and shouting patient at the front desk? Option A. Mr. Jones, I understand your frustration. Please allow me to assist you in getting this issue straightened out. Option B. Mr. Jones, stop yelling. If you cannot stop yelling, I will have to ask you to leave. Option C. This isn't my fault. Option D. Mr. Jones, I'm sure we can fix this issue very quickly. The correct answer is option A. Mr. Jones, I understand your frustration. Please allow me to assist you in getting this issue straightened out. Acknowledging the patient's frustration while offering help is a de-escalation technique. It maintains professionalism without arguing or making unrealistic promises. Question 8. Insured mail through the USPS is defined as option A. Mail that is guaranteed to reach its intended destination. Option B. Mail that has value up to a certain amount which can be reimbursed if lost in transit. Option C. Mail that will require a signature upon delivery. Option D. None of the above. The correct answer is option B. Mail that has value up to a certain amount which can be reimbursed if lost in transit. Insured mail provides financial reimbursement up to a declared value if the item is lost or damaged in transit. It does not guarantee delivery or require signature in the same way as certified mail. Question 9. A physician has requested that a letter notifying his patient that he can no longer care for her due to her multiple no-shows would be best sent. Option A. Insured. Option B. Parcel post. Option C. Certified. Option D. COD. The correct answer is option C. Certified. Certified mail provides proof of mailing and delivery, which is appropriate for formal patient termination letters. This documentation is important when ending the provider-patient relationship. Question 10. The postal abbreviation for Idaho is option A. IH, option B. IO, option C. IA, option D. ID. The correct answer is option D. ID. The official USPS abbreviation for Idaho is ID, IA is Iowa, and the other choices are not correct state abbreviations. Question 11. The standard for folding in 8 1/2 inch x11 letter to fit in a number 10 envelope is: Option A, fold in half long ways. Option B, fold in half short ways. Option C, fold into thirds by pulling the bottom up and then top down. Option D, fold into thirds by pulling the top down and then bottom up. The correct answer is option C, fold into thirds by pulling the bottom up and then top down. A standard business letter is folded into thirds so it fits neatly in a number 10 envelope. The usual method is bottom up first, then top down. Question 12. Patients with irritable bowel syndrome will experience which of the following symptoms? Option A, diarrhea. Option B, flatulence. Option C, constipation. Option D, patients can experience a variety of symptoms that can include all of the above. The correct answer is option D, patients can experience a variety of symptoms that can include all of the above. Irritable bowel syndrome can cause diarrhea, constipation, flatulence, cramping, and variable bowel patterns. Because the presentation varies, all listed symptoms may occur. Question 13. Diabetic patients are monitored by using which of the following tests? Option A, TEB. Option B, troponin. Option C, FSH. Option D, HbA1c. The correct answer is option D, HbA1c. HbA1c reflects average blood glucose control over approximately 2 to 3 months. It is a standard test used to monitor diabetes management. Question 14. Patients diagnosed with hypertension are given a medication called hydrochlorothiazide. How does this medication work to treat hypertension? Option A, it reduces the amount of red blood cells in the bone marrow. Option B, it allows muscles to contract more forcefully. Option C, it increases urination. Option D, none of the above. The correct answer is option C, it increases urination. Hydrochlorothiazide is a diuretic that lowers blood pressure by increasing sodium and water excretion in urine. This reduces fluid volume and helps decrease blood pressure. Question 15. Psoriasis. Option A, may be treated with Benadryl. Option B, is a skin condition involving flaky or oozing patches of skin. Option C, is most commonly found on the backs of the legs. Option D, none of the above. The correct answer is option B, is a skin condition involving flaky or oozing patches of skin. Psoriasis is a chronic inflammatory skin condition that causes scaly, flaky, and sometimes irritated patches. It is not simply an allergic condition treated with Benadryl. Question 16. Patients who have anxiety, option A, are treated episodically. Option B, are treated prophylactically. Option C, may be treated with citalopram, Celexa. Option D, all of the above. The correct answer is option D, all of the above. Anxiety may be treated episodically, preventively, and with medications such as citalopram when appropriate. Treatment depends on severity, pattern, and provider assessment. Question 17. Skin nodules such as nevi, option A, may become malignant. Option B, should be seen by a physician even if not suspicious. Option C, are graded using an acronym ABCDE. Option D, all of the above. The correct answer is option D, all of the above. Nevi can be monitored for malignant changes and assessed using the ABCDE warning signs. Even benign appearing lesions may warrant provider evaluation if concerning. Question 18. Category A drugs include those that, choose the best answer. Option A, can be safely taken during all 3 trimesters of pregnancy according to results from adequate and controlled animal and human studies. Option B, have been proven to be dangerous when taken during all 3 trimesters of pregnancy according to results from adequate and controlled animal and human studies. Option C, have a high potential for abuse. Option D, have a low potential for abuse. The correct answer is option A, can be safely taken during all 3 trimesters of pregnancy according to results from adequate and controlled animal and human studies. Category A pregnancy drugs have controlled human study data showing no fetal risk during pregnancy. This is the safest category among traditional pregnancy risk categories. Question 19. Drug schedules. Option A, relate to controlled substances. Option B, are based on the potential for abuse. Option C, are scheduled in 5 categories with Schedule I being the most dangerous. Option D, all of the above. The correct answer is option D, all of the above. Drug schedules apply to controlled substances and are based on abuse potential and accepted medical use. Schedule I drugs are considered the most restrictive category. Question 20. If a doctor's order calls for the administration of 500 milligrams of medication, how many grams should be given? Option A, 500. Option B, 50. Option C, 0.5. Option D, 5. The correct answer is option C, 0.5. There are 1,000 milligrams in 1 gram, so 500 milligrams equals 0.5 grams. Correct unit conversion is essential for safe medication administration.